Pleasure to be talking with Dr. Al Johnson, getting up early with us out in Dallas, internal medicine, and an expert on brain health and dementia. And God knows we could use it these days. So financial errors, he says, can be a sign of dementia. And Dr. Johnson, welcome aboard. I think you're making your debut with us, as a matter of fact.
Well, thank you. It's my privilege.
So financial errors can be a sign of dementia. Now, how did we come to that conclusion?
Well, there was a study done and published in the Journal of American Medical Association that looked at single adults living alone over 20 years, and they looked at like 80,000 patients or 80,000 people, and they found that there was a fairly high incidence of late payments on those people. And when they went back and looked at them, they did have early dementia. And they said it was sometimes occurring as much as 6 years before the patient was really diagnosed.
Wow. So, and financial errors, what do we mean by that?
Well, like late payments, they basically based it on late payments on your credit score. And so they had late payments, not paying their bills, not paying attention to financial situations, and they just weren't taking care of themselves because of their brain. Their brain wasn't working. They weren't vigilant in paying attention to what they needed to pay attention to financially.
Dr. Al Johnson with us. He's an internal medicine expert on the brain health and dementia. Dr. Johnson, it's been said that probably one of the greatest creations of the universe is the human brain, and we'll be able to figure out just about everything but itself. Is that pretty much what you found out in your research?
Yeah, exactly. If we don't have a brain, we don't have much. And so,
well, that's true.
Maintaining our brain is important for life, and when it does slip, it makes sense to find out what's going on. Some people have vascular dementia, where they're getting less circulation to the brain. That can be due to blood vessel disease, either carotid disease, or maybe due to microvascular disease in the brain. There are different nutrients that can help to calm down the inflammation, nitric oxide precursors. There are some medications. And then I have an outpatient hyperbaric center where those vascular dementia people get into the hyperbaric chamber, which is like a chamber they use for diving accidents, where you increase oxygen to the brain by 10 times.
For the bends?
And over a period of time, you get new vasculature formed and increase the oxygen and brain function.
Wow. How cool is that? Because, once upon a time, doctor, they said that, the brain really couldn't remanufacture itself.
Well, the older you get, it gets less plastic or plasticity, the ability to regenerate. But yes, the brain can regenerate. We see that with the dementia. We see that with traumatic brain injury, strokes, that there's a area of idle cells around the stroke area, around the dead area, and that regenerates. That you can wake that up.
Oh, and, wow.
Get good response.
And what do you think of these over-the-counter medicines or over-the-counter treatments and things like Prevagen and all? Do those actually work with memory and things like that? Have you seen any sign that those really are as effective as they say they are?
Well, they wouldn't be saying it without being allowed to say it, and some studies behind it.
Right.
I have patients that take it and say, yes, it does help them. So I sure think it's worth a try
sure.
and see what your own results are with it. The other thing, the older people like this that are single by themselves, sometimes are taken advantage of by crooks, where they try to get them to invest in shams and send them money. And this happened to my wife's great aunt, where she was going to Walmart, making out checks to an individual that was just scamming her money.
Wow.
And she was getting money orders of what she was doing,
right,
and sending them to them.
Similar thing happened to my mother-in-law. So I know how that can happen. Dr. Al Johnson, and quickly, doctor, do you see anything on the horizon that's helping out with things like Alzheimer's?
Well, they're working on it to try to figure out
Sure.
what does help with it. One of the studies shows that if you keep your brain active, is a big thing. That maintain the activity, volunteering, playing games, music, all
Crossword
those
puzzles.
things.
Crossword
Keep
puzzles.
your brain active.
Yeah.
Helps delay it.
Right. Crossword puzzles, Roku, things like that help out too?
Exactly.
Okay.
Exactly.
All right, sir. Dr. Johnson, where do we go for more information?
You can go to my website, johnsonmedicalassociates.com.
All right, sir. Thank you very much. Pleasure having you with us. We'll stay in touch.
Oh, you're welcome.
Yes,
Thank
sir.
you.
All right, sir.
Bye-bye.
Bye.